And MEH is the business entity name. The product that I'm sharing today is Arcana Recovery. So the same description you gave, that's for Arcana Recovery. Okay, I'm ready to start now. Addiction is a chronic disease like asthma, diabetes, and heart disease. Like these other conditions, it cannot be cured, only managed with lifestyle changes and lifetime support. That's why we created our app. My name is Sharina Johnson, CEO and co-founder of Arcana Recovery, an AI-driven drug and alcohol recovery support app that helps reduce relapse. 1 out of 8 Americans suffer from addiction. And unfortunately, 85% of those that receive treatment relapse within the first year. Admission to treatment programs cost insurance companies $34,000 per claim. Our solution uses technology to provide easy access to evidence-based tools and resources that assist users with maintaining healthy daily routines after leaving treatment. Arcana Recovery will reduce the cost of care while improving outcomes, extending recovery support accessibility, and enhancing client experiences. Although there are several recovery support apps, most focus on sober day trackers and community forums. We stand out from our competition because we have created a holistic experience with a hyper focus of identifying warning signs of relapse using machine learning. We understand recovery is a lifetime journey, and we will adapt and grow with our users. We have already proven Arcana Recovery is an essential addition to post-care treatment. We have facilitated over 2,000 recovery support interactions over a 3-month period with 78% daily engagement and 0 relapses. In August, we will expand our solution to 2 recovery support organizations that service over 500 clients annually. This will increase our user base and peer interactions by 20% by the end of the year. Our revenue model is simple. We will receive reimbursement payments from insurance companies. Treatment centers and recovery organizations will pay a subscription fee monthly or yearly. And based on last year's investment of $42 billion in addiction rehab industry, it is clear there is an urgent need for technology-driven recovery support management. We have a dynamic team. I have over 10 years in behavior modification program development. I've created programs for the military and school districts. Our team has a combination of 15 years in marketing and sales. Our advisor has 13 years in addiction research and outreach. Winning this award will help us continue R&D, and it is clear that Arcana Recovery will greatly impact the addiction rehab industry. And this is a great opportunity for you to save lives and reap promising investments and returns on your investments. Thank you. Any questions?
Thank you, Sharina. Stephanie, would you like to go first?
Yes, great pitch, Sharina. Great traction as well. So it looks like your business model works, right?
Yes.
All right. If that's the case, how many paying customers or users do you have right now?
We want to continue. Right now, we're still pre-revenue. We want to continue to build our user base before we actually go out. We've been only doing it for 3 months so far.
I see. All right. So what's your roadmap for the next, 6 months or 1 year?
So I want to continue to refine the product, especially our AI, continue to train it, as well as continue to raise funding so we can expand our team.
Right. Thank you.
Thank you.
Martin, would you like to go next?
Sure. Hi, Sharina. Thank you so much for the presentation. Couple questions for you. So you said the app could detect warning signs.
Yes.
Can you talk, maybe a base example of something like that and how the technology would detect that?
Okay, so I'll just, because I don't want to go all the way into everything, but say if the mood is low and their mood is low over 2 days, there will be an automatic notification to their support team. So it could be their peer specialist, or it could be a friend or their recovery specialist, and they'll get that information and they'll contact them and speak with them. So as simple as mood, and there's other indications as well, such as location, um, as lack of engagement on the app. So, and there's a few others.
Sure. And my second question was around the metric of 0 relapses. Probably the best tool in the world couldn't solve the problem we have with
Right.
addiction. Obviously, there's going to be relapses. I'm curious though, because that probably further explains the detachment from the app when there is a relapse, possibly.
Yes.
Can you talk about the engagement when something like that happens, and how you think that through, and how the product could address something like that past an event like that?
See, that's why it's important that we wait at least up to a year, because like I said, there hasn't been any relapse. There has been potential relapses it caught, but it hasn't been a relapse yet, for us to fully go into that and figure out how we want to figure that situation out completely yet. And I think, are you from Harrisburg University?
No, I work with folks there, but I'm in York actually.
Oh, okay. Because I was gonna say
Jeffrey is.
oh,
Yeah.
Jeffrey is. Oh, okay. Because we just joined the incubator program there, if you know of that.
Mhm.
And they will be helping us test the AI and continue to build it out.
Awesome. Well, thank you so much. Appreciate it.
Thank you.
And off to Jeffrey.
I didn't know that, so no worries. I just want to disclose that for the group that I didn't know that. Curious, couple questions. One, would Neuroflow be a competitor, or do you see them as potentially a partner? My second question is, when you recognize that many individuals that reach, unfortunately, addiction,
Mhm.
also start out through addictions with pain medication.
Yes.
How are you developing the technology that reaches them before they may take the journey in a different direction? And then my third question is, recognizing that there's a very important element of primary care that oftentimes we miss when we talk about addiction. And so how will your app be developed and further developed in a way that we can ensure it reaches the full healthcare team, recognizing that within the world of addiction, if we don't reach the full team, we're going to continue to have missing cracks.
I agree. So the first question with Neuroflow, they focus on PTSD and mental health, correct? Are they also in addiction that you know? Because I thought they were just mental health.
My understanding is that they view mental health through the lens of an integrated model.
Okay.
And as someone that lost a loved one to addiction, I would argue the same. That unless we integrate
Yes,
and stop separating them, we will never beat the battle against addiction.
I do agree. It is a dual diagnosis when people have addiction. And the second question, I can't remember right now, but the third question, right now we're working with recovery organizations, and usually they're attached to the healthcare branch. So through them, they'll be connecting mental health. If they do use medication, they'll be connected with that doctor as well. So we're trying to hit every branch as we continue to grow. The second question.
I don't even remember, so don't worry about it.
Well, great questions. Thank you all.
Thank you, Sharina. Great initiative.